Good morning, good afternoon, depending on your time zone. This is Mike Martinet. I'm the chair of the International Association of Emergency Managers Disaster Cost Recovery and Finance Caucus. And we're pleased and fortunate today to have Witt O'Brien's presenting an insider's guide to COVID-19 assistance under the CARES Act. And IAEM, since the first week of April, has been hosting regular webinars, and this is an added plus for us. We've had somewhere in the neighborhood of 1,300 people join us on all of our webinars, and so we welcome each of you today. I'm going to turn it over now to Brad Gair, who will introduce himself and the other presenters from Witt O'Brien's. Brad?
Thank you very much, Mike, and greetings to the family of emergency managers nationwide. It's great to be with you all today. We would have probably been expecting, if we got together in late May, to be talking about hurricane season or flooding or tornadoes, but this is obviously a unique situation. So thank you to everything you're doing out there. And we know that lots of you have been at this now for weeks and months and are getting tired. So just glad to be a part of a profession that has become so important to our nation. Appreciate all the hard work. Next slide, please. I'll introduce our team briefly. I am Brad Gair with Witt O'Brien's. I'm a principal with the company. I've got 25 years of experience in emergency management, ranging from county government in rural Arizona to a FEMA Federal Coordinating Officer, to the mayor's office in New York City, and some consulting work, as well as a vice president for NYU Langone Medical Center in New York City. So I've had a lot of different experiences, and I'm also a CEM, and I'm also just recently, at the end of last year, I ended my 3-year term as a CEM commissioner, and it was certainly a privilege to be able to review applications from CEMs aspiring to be CEMs and AEMs, as well as those who were re-upping for another round. Glad to see so much professionalism all around the country and around the world. With me today, I'm joined by Jonathan Hoyes, who just recently left FEMA as head of their public assistance program nationally. Jonathan, in addition to leading public assistance, was the lead for Puerto Rico hurricane recovery. So he's just joined us in the last couple of months. He's now our National Director of Government Services. We also have Bill Roche on the phone. Bill left FEMA in December when he was the #2 person in the Western region for FEMA, and he's now leading all of our FEMA programs nationally. And Matt Urchel, who's Senior Consultant with Witt O'Brien's. Matt certainly knows the FEMA programs, but more relevant to today, Matt is an expert on all the non-FEMA programs, even before COVID-19. And now with COVID-19, he's probably the recognized expert nationally on all of the other CARES Act and other funding resources. So very, very important, and a great team that we've put together for today's presentation. I hope you'll find it very informative. I do want to remind you that as we go through the presentation, in order to save time, recognizing how busy everyone is, there's a questions and answers function on GoToWebinar. If you type in your questions, we will answer as many questions as we can real time, and then any that we don't get to or any that need a more substantive answer, we will answer in writing afterwards and provide them back to the IAEM team, who will send them out to everybody. So whenever you have questions, just type them in and we'll start to answer. Next slide, please. Based on all the work that we've been doing already around the country around COVID-19, we've put together what we think will be really valuable to you, a good use of about 45 minutes or a little more of your time. And what we're now seeing that this is really, to do this right, no matter where you are, whether it's a city, a county, a tribe, a territory, a hospital, a private nonprofit, really different degrees, but these are the 5 steps that we want to take you through. We want to talk about maximizing, how do you get the most out of each of these federal programs? And to do that, you're going to have to understand the programs. Then once you understand them, you really need to assess and prioritize your needs through the analyze step of the program. Then one that we don't typically have to worry too much about is optimize. There's so many different federal funding sources now with lots of overlap and special rules and brand new programs that we want to make sure that you get that best fit of all the funding programs so that you can maximize how you use the dollars. And then really conceptualize. A lot of times we don't have to worry about that because the FEMA programs are pretty structured, but this is more like what we see with HUD and CDBG-DR and some of the other programs where you actually can come up with programs tailored to your own needs. So we want to talk through how you conceptualize programs and develop really good streamlined programs and processes. And finally, we're going to talk through operationalizing all that, how you roll out, manage these programs, and make sure that you do that in a way that you keep all the funding and do all the right back-end work that's going to satisfy the federal agencies. So we're going to jump right in, and we're going to start with the maximizing piece. You can see here just a snapshot of some of the programs that are now involved or engaged in COVID-19. And what we want to do so that you can maximize is spend the next bit of time, quite a bit of time, in this presentation, talking through each of those major sources, making sure you understand them so that you can maximize, and then we'll come back and talk about the other steps. So with that, I'm going to turn it over. We'll start with the FEMA program, and I'll start with Jonathan Hoyes, my colleague. Jonathan.
Thanks, Brad. Good afternoon, good morning, everybody. I'm going to take a moment just to sort of emphasize some of the challenges that Brad touched on. And if we look at the assistance, the direct support initiatives and the financial support, the programs that FEMA is engaging in support of the COVID-19 response and recovery, we can see the level of complexity that he mentioned. When you consider that we haven't really focused on pandemic in the past in terms of the specific programs being designed to accommodate what's necessary to respond to and recover from a pandemic, you'll obviously recognize that the direct support initiatives and the programs may have been designed for other purposes. You know, numerically, by far the most common events FEMA gets involved with are, you know, natural disasters. So in some cases, some of these tools are having to be modified, used for purposes other than they were initially designed, and that leads to a lot of evolving policy. Unfortunately, the consequence of that for you is trying to hit a moving target. The concept of optimizing your recovery depends on selecting and optimizing the right tools, the right programs, and sort of maximizing each one. But in a shifting environment where those policies either are being developed because this is new legislation or to do with a supplemental appropriation, or it's adjusting existing programs like FEMA is doing for public assistance, it can be particularly challenging. And one of the things that I want to point out is not only does that challenge communities in terms of understanding how they all fit together, how all of these tools come together in your toolkit, but it also creates significant audit and compliance risk. And Matt will touch on that a little later. But when it comes to documentation, when it comes to understanding how all of these fit, we really want to encourage people to be conscious of the audit and compliance risk up front, because that may influence the way they document, it may influence the way they review or modify their own and apply their own policies, staffing, for example, overtime policies, to fit with these new and evolving programs. So we're going to get into a few of the to-dos and not to-dos on the next slide. Next slide, please, Matt. So obviously there's been a significant challenge in terms of how we consider sheltering in place, congregate versus non-congregate shelters, and we have had to adapt as a nation and individually to those changing policies. The congregate versus non-congregate sheltering was one of the early policies that FEMA put out in response to COVID-19, but they continue to provide guidance They continue to provide clarity in terms of how they're going to apply policy with different applicants across the country. And they've scheduled the new PA Program Policy Guide, PAPG as it's frequently referred to, version 4, to come out on June 1st, will be applicable June 1st. In that, there will be significant changes to the program and policy generally. So for the coming hurricane season, for the current tornado season, for earthquake season throughout, that's going to be particularly relevant. There will be in there some of their initial COVID references, the streamlined application process, for example. But again, even that document won't necessarily be complete in terms of the changing policy over time. As you're aware, the incident period for this pandemic is still open, and as we move through the emergency management life cycle and also the grant life cycle with FEMA, we can expect further clarifications down the road. One area where we've seen communities challenged is in first come up with creative and practical solutions, but then also documenting those. And the challenge has been that while certain decisions made by communities or hospital associations or other providers of essential government services, they make decisions that are critical, that they have first-hand knowledge of, that they are experts in, but don't necessarily document the reasoning. And we have been stressing, and we continue to stress to you, the importance of capturing the immediate need that you are addressing, the prudent actions that you've taken, the scope of work, and the cost. I think very often people think of post-disaster recovery as being primarily a cost reimbursement issue. And while obviously money is a significant driver here, we should not overlook the need for the connective tissue between the need in your particular community, the circumstances around it, the directions from elected officials or public health officials that led somebody to take an action that was prudent, giving all of those conditions, and then obviously the subsequent scope of work that was performed either by internal staff and resources or contracted out through a vendor, and then ultimately the cost. Without that connective tissue, it's going to be very difficult to sort of prove up some of these costs when eligibility is questioned down the road, and as we touched on already, dealing with down the road audit and compliance issues. Unfortunately, the reality of the situation, I know many of you who have already experienced, is the number of federal and state staff being available to you to provide advice, guidance, clarifications on new policies in a timely manner. Brad touched on this, but I would like to expand. When these nationwide declarations were made for the emergency and the major, that meant that all state and local jurisdictions across the nation and territories became eligible to apply as applicants, but so did all of the private nonprofit education services, health services, etc. So we are seeing a number of applicants from across the country that we've never experienced before. People who are engaging with FEMA, but also other federal agency programs for the first time. And while FEMA has certainly made a lot of progress in expediting and shortening their application process and trying to simplify it, just the sheer volume is going to cause challenges. So again, recognizing that that staff is going to be overwhelmed and they probably won't be able to get feedback to you in a timely manner, that only puts more importance, greater importance on the documentation and capturing that as you go. One last point before we move on. That last bullet is something that we've heard over and over again. The concept of FEMA being last in line or funder of last resort has been discussed on a lot of webinars, brought forward by a lot of our clients. let's be clear as to what that means. That really means that FEMA is required to take into account duplication of benefits. And so after all of those considerations of assistance provided by other federal agency programs, perhaps state initiatives, insurance, donations, after consideration of that, then they can provide funding for eligible activities. In that sense, it is last. But unfortunately, what some communities have interpreted this this language to mean is, once we've dealt with everybody else, then we'll engage with FEMA. And that's a very unfortunate way of interpreting it, because it means they may not have put in place the systems, adjusted their financial, accounting, or time tracking systems to meet FEMA requirements ultimately. And if they don't engage with FEMA for days, weeks, or months, particularly private nonprofits or those who've not dealt with the PA program, it can be very difficult to go back and accurately account for the decisions made, provide that connective tissue again, and then ultimately achieve the goal of maximizing your cost reimbursement. So I'd encourage you in your communities to make sure that people don't misinterpret what that funder of last resort really means in practical terms for you. Matt, next slide. Other common challenges we've seen, obviously, cash flow. FEMA has attempted to address this to some extent by expediting and shortening the application process, but also by providing guidance on how to go about requesting expedited funding and what that will mean in terms of consequences for communities drawing down that money, accounting for it before they apply for more. Other challenges we've seen are a lack of detail or availability on the breakdown of internal rate structures, so calculation of fringe benefit for employees within state and local government. Timekeeping challenges, often, probably more so in local government and private nonprofits. We've seen timesheets may or may not actually be required for all staff, and when it comes to accounting for the considerable effort your reassigned staff have done or existing staff over time, if the time systems are not there to be able to track not just the time, but also the function they were performing, so it can be determined as an eligible activity, then it's going to be very difficult to get reimbursed for that. Quick comment on internal policies. Obviously, those of you who are experienced with engaging with FEMA understand policies regarding pay, premium pay, overtime, etc., or even telework. But in some cases, those need to be reviewed and updated. And even though FEMA would much prefer that those policies were full, complete, and in place prior to the event, the nature of this event means that there is precedent and there will be some understanding of adjusting some of the policies to meet reality. Just for example, in your communities, you know, the incident period has been open so long that some of the ways you staff your EOCs, for example, may be challenged as it relates to your staffing and overtime policies. So recommend you take another look at those, and also other support agreements, vendors, mutual aid agreements, etc. With that, I'll turn it over to Bill.
Thank you, Jonathan. Good morning or good afternoon, everybody. The next three slides, I'm just going to quickly go over. You know, FEMA's needed to develop additional guidance. Jonathan and Brad have already mentioned that, and they're moving targets from week to week, and they're coming out with guidance that will assist the communities in understanding what may be eligible for reimbursement under the PA program. Those are what I'm going to talk about: food purchase and distribution, the alternative care sites and the warm sites for those going forward, and then non-congregate sheltering. Some of them are interconnected. The food is interconnected with non-congregate sheltering. So specifically to the food, know that there's going to be a need out there for getting food to folks that are been socially distanced by orders specific to certainly non-congregate sheltering, and those where they're quarantined in those environments. So just again, back to that, make sure that the documentation is tracked properly, that you can connect that linkage to them. It's not limited there. There are other opportunities. However, some of those would need to be connected to COVID-19 directly in the relationship of the reduced mobility of people to those imposed restrictions, and a marked increase or atypical demand for feeding resources. So just keep that in mind. Next slide, please, Matt. So alternate care sites. Many temporary medical facilities have been set up to respond to protecting lives, to the public health safety. Going forward, FEMA has provided guidance that it would be logical and smart to make sure that, hey, there could be, or may very well be, a second wave or a continued wave, incident period still open. So what does that look like in keeping some of those alternate care sites open and operational? So FEMA is allowing some of those based on the ability to show that through diagnostics or an analysis, working with the state and local governments and FEMA as to where would be best to leave those operations up and running at a reduced capacity, make them scalable, that if something were to happen, you could quickly get access and get it up and running to the capacity necessary. So again, guidance on that, recommend folks take a look at that guidance from a specific details, but know that that's out there. Matt, next slide, please. In regards to the non-congregate sheltering policy, again, right, sheltering because of distancing is not happening in your normal run-of-the-mill flood event where everybody goes to congregate sheltering and they're taken care of until such time that they apply for FEMA if it's an individual assistance environment or they've been evacuated. That's not happening to the level needed these days. So FEMA is allowed, especially where social distancing is required and quarantine is required based on high risk, or you tested positive, or you were in contact but didn't need hospitalization. Those non-congregate sheltering environments, hotels, motels, dormitories that have been converted, so on. One quick note on that, as Jonathan will speak to a little bit about that as we get into the next slide in regards to the FEMA 2020 hurricane plan. Community is going to have to take a hard look at scalable environments for non-congregate sheltering because of the social distancing and protecting the public. So just want to make folks aware that in doing so, make sure that the costs are reasonable. You've put a plan together that allows you to address the needs, of your public and keeping them safe. But if you're in hurricane-prone areas, I would suggest that communities have that plan in place to be able to go to non-congregate sheltering environments. And keep in mind, that's later in the summer, early fall, right? Schools will get up and going. So the ability to use dormitories are not going to be available. So what is the plan going forward? Do you have other facilities that can be converted, or what does the hotel motel environment look like? Jonathan, back to you.
Thank you, Bill. I appreciate it. As Bill just touched on, as we move into hurricane season, the COVID-19 pandemic has really brought the issue of sheltering into focus. And while this slide is focused on hurricane season, it is earthquake season every day. We are dealing with floods in some parts of the country. We're dealing with tornadoes in other parts. And so really this applies to all hazards in your communities. But the approach of hurricane season and the predictions of above average active hurricane season have really required FEMA to take a look at how these two incidents collide and what the consequences of COVID-19 requirements to provide or accommodate social distancing and quarantining will apply for sheltering. There has been information put out, guidance put out, policies, but as Bill mentioned, really it's going to in large part depend on you leading your communities and understanding what is in your plans, what needs to be updated as a result, and what resources are out there to help you do this. FEMA has put together a virtual tabletop and can provide support, which is excellent. But recognize when it actually comes down to it, the sort of the program delivery model that FEMA has been investing in recent years, and the way information is collected through the grants portal, etc., has changed the way FEMA does business, and COVID-19 has only sort of further accelerated that. The lack of resources to be able to touch every applicant and every community has really, again, necessitated a lot of this to move online. COVID-19, again, has also reduced the likelihood of them engaging with you directly. So a lot of the inspections will be virtual. They will rely a lot on states and communities themselves performing tasks that otherwise they may well have asked FEMA to perform or done it jointly. So recognize you're going to have to use tools like the Grants Manager, Grants Portal tool, and deal with the CRCs, the Consolidated Resource Centers, even more. One point of emphasis here is the planning part that Bill mentioned. If at all possible, review plans now, adjust plans, even if they are sort of interim plans or guidance within your community, if they don't go through a formal adoption process or review or coordination with state plans. But where you can, document the direction you want to go in, because it's going to be a lot easier for you during and after an event, not only to respond to your community needs, but also provide documentation to FEMA as to why it was prudent to take the action you did. If you adjust a plan now and it is to deal with non-congregate sheltering in a particular way, it is put forward as the community's interim plan, and you implement that plan if you have an event, it is going to be less likely to be challenged. It will actions taken in support of that plan will more easily be deemed prudent, and that you've considered other options and alternatives. So again, it's setting yourself up for success, recognizing some of the challenges that we face in this trans and post COVID-19 environment. Matt, over to you.
Thanks, Jonathan. I want to spend a few minutes talking about some of the other funding that's out there that you may be interacting with or have access to. There is the U.S. Treasury issued Coronavirus Relief Fund that was issued to state and local governments and tribal and territory governments. And I wanted to talk just briefly about some of the eligible expenses. Obviously, a number of them overlap with FEMA, but having insight into what can be covered will be helpful in deciding exactly which funding source to pursue for what. So obviously, medical expenses is eligible. Public health expenses such as PPE, disinfection of public spaces, or a lot of those same public safety measures and non-congregate sheltering and quarantine are also eligible. The guidance does allow for disinfection of public areas, but a broader interpretation of that could include central congregation points like gas stations or grocery stores, where even in stay-at-home orders, there is quite a bit of congregation. This is probably the most significant as you stare down some rather alarming revenue loss. Payroll expenses for employees that are substantially dedicated to mitigating the spread or responding to COVID-19. So looking at your staff, and as you start to make the hard decisions around who you may have to furlough or even lay off because of loss of revenue, strategically looking at what sort of initiatives are going to be deployed in your community over the next 3 to 6 to 9 months, and potentially tapping this source to reassign personnel so that greater than 50% of their time will actually be supporting these initiatives. And with that, you can take them off your government general fund payroll and potentially get some of their payroll paid for. Moving through to some other additional food delivery. So we talked about how FEMA can pay for some food delivery specifically for vulnerable populations or those with COVID-19 cases. FEMA's interpretation of that is relatively limited, but if you have a broader initiative related to food distribution, this could be a potential source you can pursue for reimbursing those measures. Also, maintaining state prisons and county jails. That's an area where we're seeing an alarming spike in COVID-19 cases. So certain preventative measures that you're employing in those areas certainly could be covered by this funding source. This is perhaps one of the most innovative approaches that you could do to mitigate revenue loss. Economic support programs. So not just looking backwards and doing payroll interruption initiatives, but also looking at how you can roll out economic revitalization programs, get businesses back in business. And then probably the most meaningful to FEMA and certainly to a lot of the emergency management staff on this call, as recent as last week, President Trump and the Treasury both indicated that they would allow this funding source to be utilized to satisfy the 25% local cost share match. So this does change the ball game, and we'll talk a little bit about this later on, and how when you are optimizing use of funds, conceptualizing programs, how this can actually help you leverage minimizing cost exposure. One final note on this funding source, though, it can't be used explicitly for revenue replacement, but there are definitely flexible strategies for deploying this use to mitigate the effects of revenue loss. We've put together just a quick spreadsheet here that could help you document some of these expenses just to understand what expenses could be covered for the Coronavirus Relief Fund. This deck will be sent out, and you can certainly use it and send it to your departments to try to tabulate all those costs. There's also a number of counties, cities, tribal governments, and territories that also maintain their own hospitals, clinics, social support services that would receive funding from HHS. So I have a graphic here that actually talks about some of the different disbursements that came through the CARES Act. Now, the 3.5 bill actually appropriated more money, and so there will be more money being injected into these areas. But here we just kind of a simple graphic that stipulates how the money was actually doled out. This is one of the few sources of funding that can actually be used for revenue replacement. So that's very key in optimizing use of funds because you can drive the FEMA eligible costs to FEMA and then demonstrate that you used your HHS receipts for loss of revenue. Another major initiative that was rolled out in the CARES Act is the HUD funded programs. So there is a new CDBG program, CDBG-CV, and they did a supplemental appropriation through the traditional entitlement communities. Here are some of the eligible categories that could be funded under those initiatives. A note on these, if you're already a traditional CDBG recipient, your 2020 allocation could actually be utilized for this as well. So you can combine the two grant programs, amend your CAPR, and use all the funding received for these initiatives. There was also the emergency solution grants, which primarily is driven towards homeless populations, but certainly important to leverage these funding sources in those areas. A number of the counties and states and cities also have a number of schools, and it varies throughout the country, but the Department of Education released emergency stabilization funding to higher education institutes. Much of this fund actually has to be used in direct support of students, especially on a higher education side. On the K through 12 side, the method actually is a formula, and in some cases is not actually a very equitable spread of money based on how COVID affected certain populations. So certainly as you look at all the funding availability, make sure you work with your schools to understand exactly how they were impacted, what funding they received, and what needs they still will have. This is a new opportunity that was just announced recently, and I think that's very relevant as you're looking at how you're adapting locally, specifically around economic development. But the Department of Commerce and EDA actually has a $1.5 billion allocated to it through the CARES Act. and they are actually pushing it through their Public Works Economic Support Program. And so here are some examples of CARES Act recovery assistance programs that you can submit an application for. Now, this is a rolling grant. The award cap for this grant is $30 million. Some may have a cost share requirement, and there is regional allocations. So I do recommend everybody go to grants.gov, type in that grant ID number, and read the notice of funding opportunity for this. This is a very flexible funding source, and I encourage everybody to go ahead and get applications in for this and work with your economic development agencies to understand how you can use it to support economic revitalization in your communities. I'm going to hand it back to, oh, actually, you know what? I'm going to move right into the analyze phase. So one of the key components of our strategy here of maximizing, then analyzing, right? So you want to go after all the funding sources, but you also want to understand all your needs in your community. And that requires engaging all the local stakeholders. So regardless if you're an entity that received a direct allocation from the Treasury for the Coronavirus Relief Fund, or if you're actually going to be reaching out to the state for a portion of theirs, generally speaking, you're going to have the same needs. You're going to need to work with regional stakeholders to understand what your needs are, absent of intended funding sources, so aggregate all your needs. For those counties that did receive allocations directly for the Treasury, a good tool to do that is putting out a notice of funding opportunity so that you can aggregate all the responses from that NOFO or NOFA and receive the applications, so you can do a global needs assessment to inform how you may actually distribute the money in the most equitable and also fair way. For those counties or municipalities, tribal governments that did not receive a direct allocation or maybe reaching out to the nations for a portion of theirs, you're going to need to conduct the same exercise. You're going to need to have a strategic plan for any money that you do receive. Many states are rolling out programs that require you to submit reimbursements of existing expenses, but parallel to that, you should actually be looking at what your future expenses are going to be. And to do that analysis, you want to evaluate some key components here. So looking at your existing local expenses, that could be the costs associated with reassigning staff. Again, here, another aspect of the Coronavirus Relief Fund is it can be used for payroll expenses, so straight time expenses for staff that are substantially supporting COVID-19 work, whereas FEMA just pays for the overtime costs. So pairing the two together is a pretty decent way of actually minimizing cost exposure. You also have a number of changes that you've made to essential and government services. So any communication costs associated with that, but certainly plexiglass or temporary sites, moving to teleworking and hardware and software, all of these expenses add up. So you want to capture all your local expenses to understand what your cost exposure is. You also have been rolling out a number of public health and COVID-19 initiatives. So these are not just short-term, but also long-term initiatives. And also consider what existing measures can be expanded upon, which nonprofit organizations in your community or county agencies that have a smaller responsibility now could actually benefit from expanding their existing responsibilities simply because they're best suited and they have the infrastructure already in place. Certainly for those counties or nations that have received money directly from the Treasury, you'll want to look at other units of local government. So cities, townships, villages, tribes. If you're going to actually be applying for the Coronavirus Relief Fund through a larger county, through the state, or through your tribal nation, getting a look at what your needs are in aggregate at a regional level. You also want to engage with community-based service providers, so understanding the impacts to the social services in your area, specifically for vulnerable populations like the homeless services, senior care, assisted living, food distribution programs, at-home visits and medical care. All of these have been dramatically impacted by COVID-19. So getting a sense of exactly what their ongoing needs are and how they've had to adapt the delivery of their services and what the cost implications of those are. And as we've already touched on, what the local businesses need. So what are not just the payroll loss, which some federal programs have already provided direct benefit to businesses for, but also what costs to adapt to the additional restrictions that are placed in the areas. Restaurants, they obviously are reduced capacity, but do they have, does everybody have to wear a mask? And isn't it the business responsibility to do so? Do they have to do an online ordering system and curbside pickup? All these things come with cost implications. So it's really important to understand how those businesses could be supported with financial assistance, specifically about driving economic activity. And then probably a really important one for seasonal or tourist communities, workforce development. So what sort of economic diversity programs can you roll out to support businesses that were traditionally seasonal or tourist-based driven that no longer have that reliable source of revenue? How can they adapt their businesses? And I touched on this a little briefly, but the school districts and school boards in your areas, they've got a tremendous cost. And I think within this emergency management group, it's really important that the regional or local school districts have a seat at the table, because they're going to be part of the solution for reopening America, is getting the kids back to school, but making sure that they do it in a safe way. So they definitely need the support. They traditionally don't have the level of emergency management support that they need, and the counties, cities, townships can provide some of that support through their existing EOCs. Brad, I'm going to hand it back over to you to talk about how we can optimize.
Thank you, Matt. Well done. Obviously, there are a lot of considerations that go into maximize, and we will be making this presentation available afterwards, because what Matt has pulled together and presented is probably the most comprehensive compendium of all the federal funding sources related to COVID-19 that you could find as a useful resource. After you've analyzed your priorities and your needs, then we really come into this piece that we don't have to do too much, too often in the post-disaster world. That's the optimizing, the identifying the best fit of different federal funding sources. And the obvious reason for that is that in most cases, we have traditional federal post-disaster programs that we're all comfortable with, which would be FEMA, of course, the HUD, CDBG-DR, FHWA, emergency relief for the roads, and others. And over time, the agencies have taken some effort to make sure they don't overlap too much. What we have with COVID-19 is a very different scenario, and you can see from this spaghetti diagram that there are so many different funding sources, and they are interconnected, they overlap. And so what you're going to have to do is figure out what is the best fit for each of the things that you determine to be your prioritized needs. And there are a number of considerations that you have to deal with, including what's the timing of them? What's available now? What do I have now versus what may come later? For instance, your state or your county may have gotten some of the state and local coronavirus relief fund, and you're not even sure if you're going to be able to share in those funds. So do you wait, or do you move forward with other funding sources? Cost share requirements. I mean, there are at least 5 federal funding programs that could pay for things like PPE. So cost share requirements and things like that become considerations. Should you go with the FEMA money, which you know is there, and the rules are pretty straightforward, but it has a 25% match unless that's later waived, or should you purchase that equipment or do other things with funding that doesn't have a matching requirement? Different administrative burdens on different programs to certainly weigh the pros and cons of. Some of the programs that are brand new, like the state and local coronavirus relief fund, have very few rules, but that doesn't mean they're necessarily going to be easy on the back end. So you still would want to think about how you would document and be ready for whatever you may have to demonstrate down the line in order to keep the funds. Different issues on reimbursement versus funds that you have in hand. So cash flow is always an issue. Flexibility, you want to make sure that if you've got some unique needs, that you are saving some of your more flexible funds for those. And of course, the administering entity is always going to be a consideration for that. So this is where this whole art of optimizing comes in. Next slide, please, Matt. And what you hopefully will end up is pairing those expenses with the best fit funding source. And it's hard for us to tell you today exactly how to do that. We're doing that for a number of our stakeholders nationwide right now, of actually digging into their projects with them and helping them to come up with that best fit to be able to optimize all the funding that they have and do the most important priorities first, and then hope that there's funding available for other things. And remember that we do have another act potentially working its way through Congress that may supplement some of these programs, may add new ones, and may have some different twists. that we'll also want to keep an eye on as we decide what to do about optimizing. But remember, on the duplication of benefits, because that's always an issue with the federal government, but don't make that a primary consideration when you're optimizing, because all the federal agencies have been pretty clear that if it's eligible under their programs and you decide to use that funding source, the easy way to stay out of trouble is just not to submit that same expense to another federal agency. So from an optimized perspective, certainly many considerations. Next slide, please, Matt. So once you've gone through maximizing, you figured out how to get as much funding as you can, you've gone through the analysis so you know what your priorities are, you're optimizing, although that's going to be a shifting target as we go forward, but you think you have a decent idea of your best fit. The next step is, if it's flexible funding, how can you develop streamlined programs and processes? And again, particularly with things like the coronavirus state and local relief fund, where not only can it be used for a lot of the obvious things that everybody knows we need for coronavirus, but it's been made even more flexible by opening it up for local non-federal match on FEMA public assistance. And we are going to send out through IAEM where you can find that information, where that was made eligible and available. But you can also develop programs for small businesses that might supplement what the SBA and other funds have done. You could also even do things for individuals and families to create very unique programs that might be able to benefit your community. So as you think through these, and you think through the innovative solutions that you might want to target to your own community, that's where it really becomes very important to start thinking through, how can I get the most out of this money based upon all that other work that I've done, and how can I think up programs that are going to meet those needs most cost effectively and most efficiently? Am I going to put more money in businesses, in supporting education, health and wellness, the community as a whole? Or we've got to remember, the governments have these huge gaping needs, and so some of the governments that got state and local funds are wrestling with, I know that the jurisdictions below have needs as well, but if I can use this to offset my FEMA match, or I can use this for other things that I absolutely need to recover, can I even afford to share down the line? So as you're conceptualizing those programs, make sure that you're looking at how well you've optimized, so that you are not asking for funding for something that you may already be able to take care of, and trim out some of those other needs in other ways. Next slide, please, Matt. So when you develop those programs, like any good sort of ad hoc or tailored programs, things to remember are, you want to minimize the regulatory burdens. We all suffer with bureaucracy that starts at the federal level, and what we tend to do is pass it down the line from the state to local government, and then if we pass it on down to businesses or nonprofits or even individuals and families, we tend to keep building up so much regulatory burden that a lot of money gets expended on administering those programs, as well as it makes it very complex and people get extremely frustrated. So what we're recommending is take a hard look at, as you develop your programs, as you conceptualize them, what's the simplest way that I can put that out there? And it can be very simple things. We see this all the time, that if you want to give someone a grant to a family, make sure that you give it in a more general way so it avoids any kind of duplication of what they might have received from someone else. And that would apply to all other sorts of sub-grants that you might want to provide. The allowable activities, we definitely make sure that what you do, if you're going to create programs that make things available to others, share your funding, which we encourage. Make sure that it is for allowable activities under the grant that you received, because ultimately the federal government will hold you responsible for that. They will not go after a business that you gave a grant to, or individuals or families or schools or healthcare facilities. They're looking to you as the grantee to be the responsible entity. So make sure that you're doing things that align with the program guidance. And finally, try to minimize that duplication of the risk by really developing unique programs that duplicate as little as possible. That's the best way to avoid duplication, is to not create it in the first place. So think hard about how you can do that, and really take this opportunity, if you've got the available funding, to develop those really amazing programs that can make a difference in this difficult time. Next slide, please. And I will turn it back to you, Matt, to talk about how, after you get to this point, you can operationalize those programs and try to manage them in the most effective manner.
Brad, and Brad just touched on a really important part that we're seeing of this, is that compliance and risk is a very, very key component of this. And one of the challenges that a number of, I'm not, it's not lost on me that we are talking to a group of emergency managers that's typically used to working with, FEMA public assistance, emergency management performance grants, even some of the firefighters and police grants that are available, EMS type support services. But that is just one component of the federal assistance that's become available. And in that strategy of ensuring that as you roll programs out, you're doing so in an effective manner without risking duplication, it's really necessary that you pull all of the stakeholders that are receiving money from the federal government into one room and have conversation. We're working with a number of clients across the country where that's the first thing we do. We say stop, and let's pull all the stakeholders into the room. So let's pull the finance department that got that money from the Treasury. Let's pull the community development program that actually got the HUD funding and is starting to roll out programs somewhat in a silo related to CDBG, CV, and the homelessness services. Let's pull some of the health services folks into the room. And then more importantly, let's make sure that the Economic Development Authority has a seat at the table. Let's talk about the holistic needs. And then as we're actually rolling out these programs, we're ensuring, again, that everything is optimized and it fit the best needs. But when we talk about things like match, CDBG programs are one of the very few that can actually be utilized for FEMA public assistance matching. So if your community development office is not talking to your emergency management office, you're going to lose that opportunity to do so. If your finance department isn't talking to your EOC about the FEMA public assistance, you're going to lose that opportunity to use the coronavirus relief funds. And most importantly, FEMA having a the staff that works with FEMA funds having a sort of a seat at the table to talk about, no, don't submit that through the coronavirus relief fund. Let's actually work through submitting it through FEMA and documenting it accordingly, and building this centralized COVID-19 response within your community and not in disjointed silos is really going to be the most effective way to roll out these programs. This is also an incredible opportunity for you to engage a lot of the staff members who have had to transition responsibilities related to COVID-19, and as I mentioned, may actually be at risk of furlough or layoff because of revenue loss, to play an active role in the future. So especially if you're accessing some of that Treasury money, building up a actual coordination team to manage this entire process using existing staff. Some other important considerations: the money that you receive from the Treasury, really important that you actually silo it from your general operating fund, and so that you can actually track expenses that draw a clear line between that funding commitment. Also, make sure that you're working with the local health officials to understand the measures and recommending how services in your areas are going to be impacted, because that obviously has cost implications and often at times increased cost implications. Again, I mentioned consider how you can reappropriate furloughed staff and mitigate future layoffs by using those resources. We know that FEMA public assistance obviously has an administrative set aside where you can engage your local staff in participating in those efforts. Certainly some of the coronavirus relief fund, you could certainly do that as well. And then as the cash flow constraints become an issue, you may have to still lay staff off. So I think a very important operationalizing component here is ensuring that you have temp staff augmentation able to scale, specifically if you're in that hurricane prone area where we've seen that FEMA is going to have a very minimized boots on the ground approach to responding to disasters this year because of the COVID-19 crisis. They're going to increasingly lean on you as at the EOCs to actually roll out a lot of the recovery programs. So you need to have a ability to scale those, to use some of the emergency management performance grants, et cetera, to prepare in advance of what that might actually look like. And this is obviously an opportunity where having pre-positioned contracts is a very, very useful asset. And if you are impacted in this crisis and you need to be able to scale resources, but cash flow is an issue. Obviously, FEMA being a reimbursement-based program, if you can't make payroll, you can't submit payroll for reimbursement. So being able to augment with contractors who work in a little bit more flexible 30, 60-day terms, obviously, is one strategy to mitigate that. And they very well could engage with local community members as part of that. I'm going to hand it back over to Brad.
Thank you, Matt. We were very conscious of the time and we are coming to the end. So one thing I wanted to hit on is what you can do if you need help. And this is not intended to be a commercial for Witt O'Brien's. We're one of many companies that do this work around the nation. But what I want you to know is it's okay to ask for help, and there is funding for help. When I started out my career as a local county emergency manager in rural Arizona and had a FEMA disaster, I didn't have any help, and I eventually figured it out and learned the program, so it can be done. Similarly, when I was in the mayor's office in New York City after Hurricane Sandy, New York City has 325,000 employees, but really less than 5 of those 325,000 understood the federal programs. So I was not shy at all about getting contractor help of experienced people who knew how to do this. So if you do need the help, these are some things you can look for in a good contractor, and some of the funding sources can be used to pay for those costs. So if you need it, definitely think about it. Next slide, please. And as we get ready to close out and turn this back over to our hosts at IAEM, just want to remind you that if you have any more questions, go ahead and type them in. I'm caught up, other than for the last couple that might have come in the previous minute or so. We'll answer all the questions and get those answers out in writing through IAEM, as well as some supplemental materials that you might find useful. So with that, I'm going to thank you all for your time and participation today. Thank you for all that you're doing out there. Very proud to be an emergency manager, extremely proud to be a member of IAEM, and fortunate to be a CEM. So back over to the IAEM team to close us out.
Thank you to all of our panelists for excellent information. This clearly demonstrates the complexity of the cost recovery process in this particular pandemic. I mean, it's tough enough under normal conditions with FEMA, and now it's compounded because there's an embarrassment of funding available, but it's also accompanied by an embarrassment of lack of solid information and operational information. And I thank our panelists today for providing a great deal of information on how to better manage this process. With that, we're going to close. I want to remind you that we have one more remaining scheduled webinar with IAEM, which will be a little less than 2 weeks from today, the Tuesday, I think the first Tuesday in June, excuse me, second Tuesday in June. And with that, thank Witt O'Brien's for their generous contribution of time this morning. And with that, I'll turn it back over to Chelsea or Olivia.